So today I have Dr. Brad Kane here from the Calgary Center for Health, and he's going to talk to us a little bit about just taking care of our bodies. And Brad, I know one of the challenges that we often have in the dentistry world, but also for everybody that's working on computers, is our posture sucks. And so we're always, I know for me especially, got some pain in the back of my neck, sometimes for me, even into the jaw muscles. And I think it has to do a little bit with how I'm working all day long. So can you help us figure out what we're doing and maybe some ideas around how we can do that better, or things that we can do to keep ourselves from constantly being in this kind of state of tension or pain that radiates sometimes the neck and into headaches?
I think the only thing more dangerous than someone sitting on a laptop is a dentist sitting on a laptop.
Okay, so it's a bad combination.
It's a double whammy for sure.
Yeah.
So the big thing is when you're working on computers is, again, that forward posture and then the length of time that you're spent in those positions. So micro breaks are really, really important for people. So dropping your hands down, and as we had just finished a talk with your staff about really turning your thumbs back to be able to get yourself more upright. A little bit of mobility, make sure you got some water handy, and ensure that the tasks that you're doing are complete. Stand up and then start the next one versus blending all that time together. It's sort of time spent here can't be opposed by a 30-second stretch. It really needs to be broken up into periods that are more recoverable.
So what would be a good timeline for us? How often do you want to be? Because again, if we're working, how often would be a good amount of time to stop, stretch, and kind of reset your body and get back into things? Is there some sort of metric around that? Or?
They've tried apps where it's a timer and it goes off, but the problem is it breaks concentration, so that's a big thing.
Yeah.
In the pain and inflammation cycle, what we often find is that by the time people have something mechanical going on, pain is pretty late. That's the last thing you feel. More there's going to be a sense of tension or a sense of fatigue or whatever. So I think when people, instead of having a specific timer that alerts you, breaks your concentration, get out of it, is that once you complete some sort of a task or a step, just be mindful that that's the time to stand up and stretch and kind of give yourself some time. And I think the variation in the timing of those stretches and those little micro breaks, as we call them, is more important than just committing to one every few minutes, just having that variability.
Okay, awesome. When people are, obviously, sometimes you wake up on the wrong side of the bed and your back's a little tight or you feel uncomfortable. When is it that people need to get help, or it can just be stretching at home? Is there something that we should be looking at? Because I know that you work with not just chiropractors yourself, physio or massage or, heat or acupuncture, all these different things that we have. Mm-hmm. When is it that we should be starting to look for, somebody to help us in our
So our professions are quite akin from the perspective that we're really good in a reactive sense, but that's not where we want to be. Our real benefit is the preventative sense.
Okay.
So what I mean by that is if someone comes in to see you or I when they're already in an injury or a crisis state, it takes a lot longer to get out of that. So doing things that are preemptive, annual or biannual checkups to make sure that your spine, in my case, or your teeth, in your case, are doing the right things and operating the right way, address any issues before they become painful and debilitative, and that's really the time, is to make sure that before you have something going on, make sure you get checked.
Okay, so you actually do recommend, and that's great, that getting coming in once a year and just getting an assessment, see how you're doing, and then kind of going from there and building off of that.
So I've joked before is that I've never been to the dentist and been upset when they found nothing. So,
yeah, absolutely. Right.
So same thing goes in my office, is that if someone comes in for a check and be like, you're good, that's going to be the best visit that you've had, is that there's been nothing found, and you can continue to do the things you want to do.
Okay. So in terms of I guess when people get into acute situations, do they just call and just kind of start something up? What happens when you maybe you don't have a provider? And you find yourself in an acute situation that's pain, maybe related to back or musculature. I'm sure some people probably go to their MD or their doctor first. Can they just call a clinic, and yours or another one? Is that just something that people can do? Do they need a referral to get into see a chiropractor?
No, we're primary care is how we're listed in Alberta. We're a primary care doctor, basically. So no referral required, and we're diagnosticians, so we can basically assess someone on the spot. When people call our office, they're like, hey doc, my L5 is out. It's not usually the conversation. It's like, I'm hurting and I don't know what's going on. I need some help. So that idea that we create a safe place for someone to ask for help, and then help them determine what the cause is, and then what's the best course of action to direct it. So if people have questions, conversations are always free. Just phone us, and we'll figure out where we need to send you.
Okay, awesome. So I know a couple of things that you did for us, and we're going to try to do that now. Is just a couple of little exercises, almost 5 or 7 minutes worth of stuff that you can do on a daily basis to just try to keep yourself a little healthier, so you maybe avoid getting into some of these challenging situations.
For sure.
All right, so help me just keep myself a little healthier over time.
Okay, perfect. So we know that everyone watching this is on their phones right now, so they're all sitting like this, right?
Yeah.
So what we want to do is, first off, is address the concerns that might be in the forearms. So a good way, really simple way to do this is just take your fingers in your palm. You can extend straight out like this, and then you want to twist your elbow back and forth like that. And that's a good way to stretch out these flexors, which is when you're holding your device, that's the muscles that are operating. But not to be left out is the extensors. So you just take your hand in the opposite direction like this. Same thing, just rotate back and forth. Yeah. Super simple to do. If you're at your desk, just put both hands on your desk surface and then twist back and forth.
I know it's funny though, I feel that like when I use my phone more often, I find that this area hurts a lot more often. I'm like, oh.
Just under load for like it's time under tension.
Yeah.
Right. So if you're struggling with the Wordle, take a little break, right? The other one, another really good one that we demonstrate with your staff just a little while ago is we all stand like this with posture now, and maybe we can demonstrate when we had everyone do this. Fix your posture. What people do is they pick their shoulders up and then extend them this way, and it adds all kinds of tension into the upper back, which just leads to headaches, and it's kind of a weak, thin muscle anyway. So you want to use this latissimus muscle, which is a really thick one. It kind of goes, if I can demonstrate on you, it starts here at the shoulder and then it goes down towards the glutes. So it's a long muscle, it's very powerful. The easiest way to activate it is if you just stand there, depress your shoulders, and then all you want to do is turn your thumbs back as far as you can. And it'll literally just pull you into an upright position.
Yeah, it feels better.
Yeah, so you can do the seated as well. So if someone's sitting at your desk right now or on your phone, put the phone down, thumbs pointed towards, or hands towards the floor, and then rotate back, and it'll put you in a better position. It's one of the most effective things that I do in my practice because I'm all day like this. So I just stand up, quick little reset, and it fixes. Okay, and it'll take all this tension off your neck. Third one is because these muscles here get really short and tight and sore when people are just like this all day. So instead of like extending the neck into kind of a compression type position, you don't want to do it. What I like to have people do is extend, then go back. And that'll get you a good stretch on these neck flexors.
Say that again?
Yeah, so instead of compressing, what you do is extend the neck up as high as you can, and then pull back, and you'll feel way more tension in the front of the neck under the chin.
Okay.
Yeah.
Yeah, because I can feel this side.
Exactly.
Okay.
Yeah.
I'm always looking this direction.
Totally.
It's always shorter.
You know, as you're sitting in meetings, you always sit the same way in a meeting, right?
Yeah.
Yeah.
Yeah, I know for me and patients, because the patient's going to be here,
Yeah.
I'm always going to be
Always
slightly
turn.
tilted to one side. So.
And people have handedness and posture in the way that you do that. So your offices are set up the same way. So when you interact with the patient, it's often the same position, which creates that long-term postural stress.
Okay.
Yes.
So if patients want to find you somewhere, if patients have a question or they want to get in, what's the best way to get a hold of you?
Yeah, our clinic's called the Calgary Center for Health. Our website is calgary.spine.ca, and our Instagram is cch.yyc, and all the information's there.
Okay. Awesome. Thanks
Thanks
again.
again.